Happy Friday, Plymouth. I hope everyone's having a great Friday. We are in session. It is the last part of session where bills can be put into conference committee. So we're dealing with a lot of bills today. So we've been here most of the week working through a variety of topics. But before I get into that, I wanted to tell you where I am. I'm in the members lounge and just show you a little bit about what the members lounge looks like. So this is where sometimes you'll come in and we'll see members having phone calls, doing different things, having meetings during session, any number of things. There's also briefings that occur here, but I thought it would be a fun little space to show you when, for my Friday update, since I was here in the city, I figured I would do that instead of, sitting in my car or my office, which you've seen. And so we've been busy. There's been bills that have come out of conference committee that have been voted on. We did that with the Protect Act yesterday, which was done bipartisan. As we know, it's enhancing the protection of our residents and our immigrants and making sure that people are protection around sensitive areas, child care facilities, medical facilities, schools, courthouses, you name it. Also making sure that parents can create a guardianship for their children, and just in case they are detained by ICE. And it goes on and on, but we'll, talk more about that. But on Wednesday, we had all of our bills really exciting, but we had an act to improve care and prepare for the new era of Alzheimer's and dementia. This is really exciting. I wrote some notes, so I'm sorry if I look down, which I typically don't. But this is going to mandate training for our EMS, our police and our fire, learning to handle our individuals with dementia. It's going to expand caregiver support. We're going to make sure that more like our hospitals have a plan when individuals are discharged, that family members know that anybody with Alzheimer's or dementia is not just let go back to their house on their own. They're going to invest in the workforce. There's going to be creation of a director of dementia care to oversee the implementation of Alzheimer's plan and a lot of what was in the bill. We'll put more out in a graphic later. And then we also yesterday did an act to strengthen primary care for you, H 5618. It establishes a statewide target of hitting 9% spending by 2030, 12 by 2033, and 15% by 2036. By investing in our primary care, we all know that that is preventative care. And so that's what the state needs to do. We need to do better to make sure that we are healthier, that things are caught sooner, and that more can be done. So there's going to be an investment in the workforce, whether that, trying to get people with scholarships, career pathways, making sure people have recruitment and really understand how, understand the importance of primary care, that they get involved and they, want to be primary care physicians. It's so important. One of our freshmen, Representative Schwartz, is a primary care physician, and he spoke about this and really powerfully about how important primary care is. It establishes safeguards for AI, so certain things, if it's read by AI, that, we make sure that a doctor or somebody else has eyes on it. Lowering prescription drug costs, improving healthcare affordability. There's a lot of great things. Supporting our community health center. So I'll put some more out about it so there's more details, but those are high levels. We have, so that's it for now. It's getting a little long, but we'll get you more information on these great bills. We get some more bills to do today as we start session pretty soon. Hopefully I'll get this posted before session starts. And then Tuesday at the main library, I have my office hours from 6 to 7, I believe. So I hope I'll see you there, and I hope everyone's having a great week. See you around this weekend.